Hello there, and many thanks for joining us on Asonye Live this beautiful evening. This June, as we recognize Cancer Survivor Month, we shine a light on the immense courage it takes to face this disease. A battle fought not just in hospitals, but against stigma, fear, and often crushing financial burdens. In Nigeria, where these challenges are acutely felt, hope takes root in remarkable individuals. Today we meet Engineer Dozie Akwarandu. An engineer by training, his life took an unexpected turn when he became a warrior against cancer himself. Surviving that fight wasn't the end, it was the beginning of a new mission, fueled by his experience and a deep empathy for others on this path. Engineer Akwarandu founded the Nest of Hope Advocacy and Support Community, a vital sanctuary offering support, resources, and a powerful voice for cancer patients and survivors navigating the often turbulent Nigerian landscape. And this month, Nest of Hope is bringing the community together in a special way. Engineer is joining us today not just as a survivor, but as a beacon of hope and action. Welcome to the show.
Thank you, Jerry,
yes.
for having me.
Yes, and well done for the work that you do. But we're getting into all of that. What cancer patients face, how, if there is even hope. A lot of people think it's the end, but you're here to tell us all about that.
I appreciate it. Thank you for those kind words. And, the introduction was absolutely something that is remarkable. And I also want to appreciate you for all the work you're doing, and also to amplify the voices and to create a whole lot of awareness about cancer, survivorship, its management, and all the rest of them. So kudos to you.
Thank you so much for your kind words as well. But it's time to go for a short break. We'll return to get into the crux of the matter. Cancer patients, let's join hands and help as much as we can. We'll be right back to get into the crux of the matter. Stay with us. Welcome back from that very short break. I still have Engineer Akwarandu right here in the studio. Now, your journey from engineering to cancer advocacy is really powerful. So can you share a moment, the time, or whatever crystallized the whole idea to something that made you say, you know what, there is a gap and I need to fill it, and the Nest of Hope was born?
Thank you, Jerry. I think it's one thing to have a call, another one to answer that call.
Absolutely.
As an active person, I was before cancer. I have practiced civil engineering for a total of 20 years, and all through those years I never had a dull moment and things like that, but it never stopped cancer in 2019. So when I finished treatment in 2020, I think I gathered some friends that I met while treating cancer. So we started a platform that is a support group where we talk to ourselves, encourage ourselves, maybe laugh over the pains and things like that. And within the period, I told myself that I never had idea that people could survive cancer, you know. But I've seen a lot of people suffering cancer. I've heard about it, but I never knew there were even so many cancers. You know, so we used to hear about breast cancer, leukemia, prostate cancer, basically. Maybe I had a little of cervical cancer, but I never knew there were other cancers, to the point that there are over 200 cancers, you know. So when I finished treatment and think was under remission, so when I was pronounced cancer-free, I was like, okay, I think I've survived. Now, I didn't survive by chance.
Right.
It was like a miracle. It was God for me, you know. So I thought of what to do to give back. How do I appreciate what God has done for me and things like that. So I looked at this experience, these informations I never had. From my experience, I could share. I couldn't just hold back, you know. So that gave back to what we see today as Nest of Hope Advocacy and Support Community, a place where we have cancer survivors come together to share experience, encourage themselves, then create awareness, help others to navigate through the journey, then at the same time advocate for improved care, you know. So we've come a long way within this last 3 years in making sure that the narratives are changed, mindsets are changed, are shifted to maybe the positive, not seeing cancer as a death sentence, but seeing cancer by its name and not just as the end of life, you know. So that's what brought about Nest of Hope and where we are today.
I'm happy you mentioned something very important, cost of treatment for a lot of people. But before we get into the survivors, I mean, we are celebrating the month. This month is celebrating them, but let's talk about cost of treatment. That has been a very serious issue because you know the landscape when health insurance landscape is the dragnet for it is very low, and we've been having that conversation over and over. When can we indeed have this universal insurance for all? But before that, cancer globally, cancer treatment globally is always very tough. A lot of people have to pay out of pocket and all that. In Nigeria, what would you say in your engagements with patients the biggest problem is, I mean, in treatment?
We can't overemphasize this. We can't talk about it so much. So no matter how you talk about it, no matter how you stretch it, it's just a little it is.
Absolutely.
You know, the financial toxicity is something that cannot be taken away from cancer treatment. So it's something that causes trauma, it's something that brings demoralization, it's something that it makes a lot of persons don't even want to dare going into it. So it's established, is known, is a well established fact that cancer treatment is costly. And now let's bring it home in Nigeria. We do not have our own treatment, right? We rely on those treatment that is being given, what we call orthodox treatment. And the cost of these drugs are dependent on the exchange rate. So and remember that I think sometime last year or thereabout, most of the pharmaceuticals left Nigeria. So we depend on importation of these drugs, which is extremely expensive. So before now it is high, and now it's higher, right? So a whole lot of persons go through difficulty selling properties, selling this and that, and begging. Like you rightly stated, is something that affects the world in its entirety. You know, it's not just in Nigeria. So cancer treatment is expensive. So for us, is we're above what we can manage. It's not something an individual can carry. It's something that needs the communal effort. Is something that needs intervention, proper intervention. And that makes me, whenever I'm talking, I look at it from this point, that we need to bring in private and public interest into cancer treatment. And I don't know how we look at ourselves as human beings, right? When greater percentage of persons are going through difficulties, going through health challenges. And you remember that a wealthy nation depends on the health of the citizenry, right? So if a whole lot of us are on this other part, so you can think about what the economy is look like. So a whole lot of persons, if you are treating cancer, you're more or less like someone who is not productive. So that's why we need to come in. That's why a whole lot of effort needs to come in. The government needs to do more in bringing effort, right, together to see how to do this. And I want to also use this month, this Survivors Month, to talk about bringing insurance fully into cancer treatment. Like something I used to think about it. How did we manage HIV? How did it happen that today is not longer something that we dread.
Yeah, we dread like we did many years
ago, right? So if we can bring in such protocol into cancer treatment, I do not see why we will not do well in it. So I think insurance should be integrated into cancer treatment.
But I would just like to ask, I mean, you just mentioned HIV, and that is transmittable, and there was so much attention globally. There was the funds that were everywhere for that, maybe for fear of transmitting it wildly. Why do you think with cancer it's not that well funded?
Maybe.
I mean, I know that sometimes cancer, there are lots of countries that pay so much in cancer treatment research and all that, but the support for patients, I don't think it's as much. And the awareness, you also mentioned earlier that before your diagnosis you didn't know so much about the many cancers and if there are even survival rates. So give us a sense of what patients, especially newly diagnosed, feel when it hits them. It's right there. In movies it's not funny, they often just tell you and give you a couple of months.
Yeah, and let me even start from where you picked this thing from. You know, the fact remains that cancer is with us. We can't pretend about it. And are we having the incidence? Is it increasing? Yes, that's the truth, including childhood cancers, right? So we can't just shy away from this reality. Now, when you talk about, maybe because it's not infectious, because it's something that happens with you and ends with you, but perhaps that's why we are not paying more attention. Just like in infectious diseases, right, where a lot of attention is being paid.
Because you're afraid you might just get to you.
Yeah, but let's look at it from this way. Now, what ravages an economy? What makes a people? Right? The health of the people matters a lot. Now, if this thing is like a pandemic, why don't we tackle it? Is it when cancer is like a war now, right? Where a whole lot of persons are struggling. And let me tell you something that is vital here. When one person in a family is going through cancer, that family suffers. It's not just that family, the community suffers. Because why? The individual involved is completely out of production, right? Now, other persons that are depending on that person are also out of this. The whole effort will be on saving the life. Because I don't know who sees a family member and watch that person to die. So you see a whole lot of attention being paid on this cancer patient, right? Such thing cuts off the entire community from being active at that point in time. Right. So if you check the cost, the effort that is being put on making sure that this person lives, right? Compare it to where everybody is working. It adds something to the economy. So this is why I think we need to do something. And that's why a lot of us are coming out to even say, okay, since also that the treatment is high, one of the things that the lowest hanging fruit here is prevention. Okay. And what do? Is to also look at ourselves, look at our environment, look at things we eat, look at our lifestyle in general, to see how we can either manage it, improve on it. And those things are things that can make your system to do. Cancer, for me, I always look at it that my body developed it. My body can also heal it, right? So, and I believe that by the time you begin to pay attention to your health, pay attention to your body, that it will respond to that attention that you're giving to it. So I think while we are saying prevention is better than cure, but for those that are being affected, what do? Do we just abandon them?
Absolutely
not.
So
we do not abandon them. We do something. And that is why I'm saying, okay, we need to also bring in efforts, make a whole lot, to make sure that these people do not stay on their own and do not also maybe die of like roadside chicken, So I think it's important that we integrate those protocols that worked in this thing. And I want to also say it's something. There are a lot of things that could be done here, because it's not all about talking. We need to also provide solution. And in some countries, in some climes, there are screening protocols where at certain age, people are mandatorily screened for certain cancers.
Oh.
Right? But those are the things that we should begin to look at in Nigeria. And it will go a long way to help us. For instance, today, colorectal cancer is really affecting much younger persons than it used to be.
Is it because of data? Is it that we now have the data to know?
No, unfortunately, what we do with data, we do not have appropriate data.
Yeah.
Like every year we say that about 125,000 is being diagnosed, 80% of it, that's 80,000 persons dead. So
it's always vague.
Good. Between these numbers, right, you can't establish the number of survivors. Okay? Now, apart from breast cancer that you can say, okay, that a whole lot of persons are talking about, you can't say this is the number of breast cancers, this is the number of cervical cancers, this is the number of this thing. And I want to tell you also here that a whole lot of persons die of cancer without being diagnosed, right? So like in recent time, I've seen about 3-4 persons who had similar experience like mine
and symptoms
right, that never got diagnosed before they died.
What happened there? They did not go to a hospital, they did not get checked?
Like in my case, a lot of us also went to hospital, but we had this misdiagnosis.
Oh.
So we've been treated. I was treated for ulcer for a couple of months or thereabout.
Wow.
Right? From there, acid reflux. From there, abdominal disorder. So diagnosed of different things. And what surprised me most is that at the time I was diagnosed of cancer, it was stage 3.
And in all of this, nobody noticed.
Nobody noticed it.
Wow.
And there was a tumor as big as 3.5 cm or 4 cm. So something that you could measure, that something that is as large as, right? That took off an entire colon. So things like this, assuming you have a protocol where, okay, if you're having this, you need to screen for this. Definitely those things will help. As we speak today, if you go for a colonoscopy for maybe in a private setting, I don't know how you feel when I talk about it, it pays as much as 350K, right? So in public hospitals,
and is it covered by insurance?
It's not covered by any insurance. It is not. So a lot of us also, because you've not eaten, right? You've not eaten, so
how would you go
such
300,000 naira for something that's so far? You know, for a colonoscopy, you don't have signs. You just want to check.
You want to check.
Oh my goodness!
Right. So because you've been having constipation, you've been having this bloating stomach, because you've been because at a point, my food stopped digesting.
Yes.
This is me now.
Wow.
Right. So I'll eat. I feel those things still remain with me. So the tumor has completely blocked off the passage that I could not also do. So all those kind of experiences, people do have it even to today. And that's why at those stages of cancer, you begin to have complications. Okay? So I think I'll also use this platform to call on authorities to establish protocols or procedures on how to have these things. For instance, there are some places where it is advised, if a woman is 40 years,
You
do
go-
a mammogram.
yes.
You must do a mammogram. So I'm happy about what is being done on cervical cancer, the
Yes.
HPV issue and things like that. It's also instructive for people to know that these things are something that will help us in the future.
Absolutely.
It's been tested.
Yes.
Some countries have seen that, oh, within this period, we've not had an incidence of cervical cancer. So if this one that we have a vaccine, because I think cervical cancer is one cancer that has been proven to have at least 70 to 80% cause, right? Where you can lay claim and say, okay, this is what led to this, or what is the cause of this. So every other cancer, what we rely is on risk factors, right? So those risk factors are things you cannot say, okay, this is
exactly why. Exactly.
Okay, and again, within this, I also want to establish it that attention needs to be paid on childhood cancers too. You know,
And it's unfortunate, the numbers we are recording lately.
it is increasing by the day. It is increasing. So we have a whole lot to do, a whole lot to talk about in cancer space, right? The numbers, the data you're talking about is even something that I do not know where to start, right? The cancer registries that are available in Nigeria, I don't know how I can talk about it, how you can do. So you cannot just come and say, this is what's happening as far as cancer is concerned in Nigeria. So everything we're talking about is estimate. So I think it is our time now that a lot of us are coming out to talk about this, to have all these things integrated into the system to improve the outcome.
Now, you've mentioned really important issues, especially when it comes to the cancer space and people suffering this. And my heart just goes to a lot of people in underserved communities who would be facing this. Remember, I don't like to say it like this, collapse of the primary healthcare centers. And individuals who are well off are suffering. I mean, you, as educated as you are, was not diagnosed until it got to stage 3. My heart bleeds to feel or even think that there are individuals like you who do not know until it gets that late. Sometimes they do not survive, and if it was only caught earlier. So what are you doing? What is the Nest of Hope doing to ensure that people in underserved communities, people who already suffer so much from lack, how do they have to survive? What's the chance for them?
Maybe I'm not in this program to shock you or to tell you something that will surprise you, but like you mentioned, that is our reality. You can imagine, as vibrant as I am, not having knowledge of this. You can imagine what happens with the underserved communities. I think about them most times, and I want you to even know something. We had a program in March in one of the suburbs here in Abuja. 70%, March was Colorectal Cancer Awareness Month. 70% of the participants that didn't know what colorectal cancer is have not heard about it. 70%. So the 8% that have heard it from this survey we carried out, the 8% that have it doesn't even have any concern about. To them, it's like, okay, we've had it, but
yeah, it's something that's out there.
Do you understand? So it's like something that's vague. So for me, it's like we need a whole lot or a lot to do to reach out to people. But I'm happy that a lot of us, a lot of organizations are really coming out to do this. But a lot are also concentrated in the
towns, exactly.
Right?
That's so something I have a problem with.
That is yes. Why. But I will tell you why. This your platform is something that we also need to amplify these voices, right? Now, for an organization like Nest of Hope that is self-funded, okay, we can only do what we do because 70% of the members of Nest of Hope are cancer patients, survivors, right? So they do not also have enough to take care of themselves, let alone to fund events. Now, the other percentage is maybe people who volunteer out of their will that do this thing. Now, we tried, and that's why we looked at it that, okay, we can't concentrate our effort in the town. Let's move to the town. So move out of the town. Yeah. So most of the things we do are in suburb areas. And I'm happy to also state that Nest of Hope so far have a presence in Abuja and in Abia State. Okay. Right? So trying to see what we can do to just show that, oh, cancer is real. Cancer is survivable. Cancer has a treatment modalities, right? So cancer also have preventive strategies that you can adopt. You know, so those are the things we try to do once in a while. So, but it's not enough, right? So we're also looking at people coming in, more people to come in, more survivors coming in, all right, to talk about it. Because the only way, just like in globally, what we are looking at, I think it was declared in February this year as the theme for the next 3 years, United by Unique. So it's bringing a community together to talk about cancer, its treatment protocol and this thing. So, but it's been looking at treatment also on the patient. Okay. Right? Is like looking at this treatment on the patient-centric concern and not just the disease. Right. So it's no longer a time where you begin to treat this disease. It's a time where to look at where the treatment consider this individual, the values, the goals, the aspiration, the needs, right? Because in as much as it's cancer, every experience differs. Of course. So, but when we integrate this, it gives a better outcome. It gives room for more improvement, you know. And also use this Survivors Month also to, especially in Nigeria, where we lack synergy. All right, we need to come together. We need experience and expertise to come together to improve this thing. Because when you probe a problem, you get more exactly to solving that problem. And that is one of the things we lack here. So I think it's good that people like you, all right, who in the media, and I think I will also want to use this opportunity to also talk about you and the other people in the media. Because if what you're doing, that a whole lot of persons are doing it, right, we will also give more voice to this. Exactly. And definitely giving more credence to whatever we are doing. So every effort matters. And every 1 naira would go a long way. Right. Well, it's time to go for a short break. We have still so much to discuss. Did you know that misconceptions and stigma also exist in the cancer space? We'll be discussing that. Especially, we'll also go to the events that will be coming up. He's organizing an event. We'll get to that event, how you too can participate or even send your support for that event. We'll be back after this short break. Stay with us. Welcome back from that. Engineer Dozie Akwarandu is right here. While we were on the break, he shared something very important. He says there is a good side to cancer. I think we'll start on that before we get to the survivors, the misconception, and the psychological needs of these survivors. What do you mean when you say there's a good side to being a cancer survivor? Well, I think I am one person that do not see negative in everything, you know, every bad thing. Yeah, cancer might not be a good thing, but somehow I think I made cancer my friend at a point.
What does that even mean?
I wanted to like look at it at a point.
Like have a relationship, have conversations.
Yeah, just conversation, you know, because I didn't know how it happened. I was an active, like I could say, all my life I've examined it, you know, looked at it. One, an active person. I've lived a decent life. I've never lived a reckless life. So when you talk about some of the risk factors about cancer, right? I don't smoke, I don't drink, maybe just think about it. So I was like, why me? But instead of thinking, why me, right? I had that opportunity to think, how did I survive? Why did I survive?
Right.
Right?
It's a good way to look at it.
I looked at it from that perspective because during treatment at the point I was just like floating. Yeah, and I could also tell you, I wouldn't want to tell you that during the course of treatment, at the point I became overwhelmed. I didn't want to continue. Right?
Wow.
So, but somehow, interventions, my twin sister, my friend, he's a medical doctor, possibly that guided me, but that's a different story altogether. We had that conversation and said, Dozie, you can't stop now.
You were psychologically overwhelmed?
Yes, I was overwhelmed. And at the point, I wanted to like stop. I said, whatever, I mean, I'm tired, you know, let me just do this. But after this, you know, just like they say, after the rain comes shine.
Right.
So when I saw this, I was like, how did I survive this? Because I saw the percentage rate of survival, right? I signed my own indemnity. So how did I survive? How did I even become strong? From maybe someone weighing 75 to 53.
Wow.
Then losing all sorts, losing jobs, losing money, and surviving. I was like, okay, why did I survive? Now, for me, this is the positive part.
Okay.
I discovered more about me. I've been someone, I could say I care less about so many things, but I live a very decent life. But then I knew what gratitude was. I got to know what patient meant. And today I know what, like, before you can't talk to me or you can't maybe do anyhow with me and walk away, right? But today, I watch you walk away. I can even aid you to walk away, right? So I think cancer helped me to identify another part of me, to discover that there is a whole lot in humanity. There's a whole lot to gain when you're patient, right? And again, it gave me this opportunity to show gratitude in every little thing, no matter how it is, no matter how small it is, and gratitude to God. So for me, there is a sovereign God, right? I do not question that again, because how did it happen? Money couldn't serve me, friends couldn't serve me, family couldn't serve me, right? But a superior power helped me navigate through this journey. And then the greater part of it is discovering what I'm doing today. And I said, if for every cancer, any person going through difficulty, right, look inward to see if there is a purpose. And if you discover that purpose, it gives you also the strength to continue to thrive.
Exactly.
So today I do not even, I say it, I do not see myself as a survivor. Yeah, I don't call myself a survivor.
What do you call yourself?
I call myself a thriver, right? So, but one thing is that before you thrive, you must survive. Okay, so I have survived. So I see myself, I'm a thriver.
Right.
So I thrive, and it's just like that for me. So if not for cancer, maybe I would know through other means, but cancer made it possible for me to identify these things. And today, I could put my time to saving humanity, to making sure that people are happy even in their difficulty, because I had an experience. Today, I could be able to stand with you to tell you, no, there is a healing power even within you. Today, I could stand to tell you there is something you can do even in this, with these challenges. You know, so those are the things that, and while doing it, I am gaining more strength.
Right.
I'm gaining more authority. I'm gaining more power. So it's not just service. I do not see myself. Some my friends will say, Dozie, you're sacrificing a lot. No, I tell them I'm not sacrificing anything. I'm only privileged to do this. And those are things that came because of
you too had gone through that.
So for me, I don't know what positivity meant other than this. I do not know what else you could gain from you, from anybody, other than this.
This, exactly.
So
exactly.
everything I'm doing is anchored on survival. Is anchored on the fact that I'm standing here talking to you, talking to the whole world, okay? And I'm inspiring someone, okay, to take action. I'm also calling on the community at the same time to come together, rally round to make sure that this thing is, the door is closed behind cancer.
Now let's quickly talk about the stigma, the changing narratives, especially the misconceptions around it. Why do you think that is?
Well, we can't also run away from it, can't shy away from it. That's one of the things that are making people not to owe up or to
admit that they even have the disease.
Yes. Is known. A lot of people are aware that cancer is non-communicable, is not transferable, but still there is this isolation that comes with the fact that someone has cancer. There is this sympathy in quote that comes with it. There is this.
Is a sympathy particularly a bad thing?
Yeah, and I will tell you why it's not always good. It doesn't seem right. Yes, the person that is going through cancer has a lot going on in his or her mind, right? The psychological problem, the emotional issues, right? The physical issues, because cancer is not just physical. It's both psychological, emotional, even spiritual, right? And I will tell you something, maybe this is where our communities and religious leaders and efforts need to also come in. A lot of persons believe that cancer is bad omen, and you can't take it away from spirituality and religion.
Right.
Right? So
you must have done something wrong.
You must have done something wrong. It's a punishment.
Wow.
Okay? That you're serving, and that is why you're having cancer. Now, if you go to certain religions circles, right, you will see where it is proclaimed that you must have offended God. Possibly you are receiving punishment. So some of those things make people not to owe up, not to come out to say it. You don't want to be seen as evil. You don't want to be seen as someone who has offended the gods. You don't want to be seen as someone who has, and you know those kind of things come with isolation, right? So at the end of the day, it leads to depression, which also you cannot.
So you are isolated.
Yes.
And exactly.
Yes, because
how about workplace? I know that. I mean, if you suffer this among your social circle,
you can imagine even among your siblings in the house,
in the
family, a lot of persons do have their family, their spouses walk away from them. Yeah, they suffer alone, a whole lot of persons. So you can imagine when that happens within a family. What about the office?
The office.
So a whole lot of persons do not want to be identified with the disease because they will be relieved of their duty, fear of being relieved of their duty, fear of losing.
Well, I'm just thinking the laws that protect us.
Unfortunately, there's none. Unfortunately, if there is not in existence. It has not been like. In fact, nobody has explored that. So I think there is none. And you have mentioned something that is very important here. I can refer to you to Kenya. In Kenya, they are protecting. They've integrated cancer patient and cancer survivors into Disability Act.
Oh.
Right? So where cancer patients are also taking the tax burden are taken off from them, right?
Okay.
So
in pharmaceuticals that they need and
everything. In
wow.
everything.
Oh, that's good.
Yeah, I know about it because I have some groups that we cut across in Africa, right? So where we talk about this, and so we're also in Nest of Hope doing some things globally, so within Africa and globally. So I think part of what maybe when we get there,
let's just talk about it because we're really running out of time, and I want us to talk about the events coming up.
Part of what we are doing in Nest of Hope is to community engagement. Our communities cut across the indigenous communities, the religious communities, the institutions. So the essence of these things is to talk about all those gaps, because within our communities there are a lot of laws or maybe unwritten laws, all right, that seclude these diseases, that sees them as maybe something evil or something. So those myths and misconceptions you mentioned about exist, and the communities do not believe that, these things is something that is within you. So it must have been something that is that devilish or something that was done on you as a charm or whatever. All right. Now the religious part of it is also the God forbid thing, where as a maybe you have a disease that no, it's not my portion. Okay. So those are the things that make people. You've had somebody say it's not my portion, so you don't want it to be
your portion. Exactly.
So if it happens, invariably you wouldn't want to owe up. You don't want it
to be seen as
do you understand?
As one who is not religiously capable enough to even attract that kind of disease.
Same thing with our workplaces. So where people hide from this thing because they don't want to be disenfranchised or something like that. So a whole lot of things happen within, from here to there.
Wow. So let's get to this very important and special event you are organizing, commemorating the Survival Month, Cancer Survival Month. What do you hope to achieve by gathering these individuals in one place?
We talk about cancer because people are surviving, right? And that is very instructive. So we need to celebrate the resilience of these people. We need to celebrate the strength. We need to encourage also what they are passing through. Then we need to inspire so many people, learn and spark action, because it doesn't just end in talking. We also want to see more being done. So that's why we on the 28th of June this year, because June is globally National Cancer Survivors Awareness Month. So we have picked 28th June to celebrate the resilience of these warriors, these champions, who have passed through, who are passing through this thing, who are also championing the effort to see that things are improved. So we are having a gathering, survivors gathering, which we have tagged Fighting in Unity, Surviving Together, on the 28th of June. And that's happening in Wuse, Novel Mall, Wuse 5, on the 28th of June by 2 p.m. So we are having a whole lot of cancer survivors, bringing both the children, childhood cancer survivors and adult cancer survivors. And it's interesting to know that we are not doing this alone. We are collaborating with a sister organization that's doing wonderfully well about childhood cancer. They have done absolutely well in terms of childhood cancer, sponsoring their treatment, their education, seeing that a lot of persons are aware that our children do also have cancers of different areas. So we are collaborating with them. They are bringing survivors, and that day we want to also test their abilities, you know, to also show that cancer is not the end of life. There is a lot you can do. So you will see those cancer survivors do artworks, do a whole lot of things, you know. So we have also outlined so many things to celebrate with them, you know. So we're going to have maybe prizes, dance, gifts,
sounds like a day of fun.
know? So it's just a day of fun. We're not going to lament. That day is not
for
I think you're going to be there, you're going to show it to the world that
you can actually keep it aside and have a good time.
I mean that cancer survivor, as a cancer patient, you can do whatever you want to do, you know, no matter how you do it. You know, we can even tell you that, you see, people are afraid that cancer make you won't have children. That day you will see that
survivors
have children, survivors get pregnant, survivors impregnate women. So just whatever you want to do, you do. Cancer does not stop your life. So that's the essence of
that's
that
really
day.
powerful. Thank you so much, Engineer Dozie Akwarandu, who is the founder, Nest of Hope, Advocacy and Community and support community. Thank you again for being part of the program and the work that you do. I'll see you on the 28th. That's tomorrow.
No, next week.
Next week Saturday.
Yeah.
Yes, that's next week Saturday. Well, it's going to be a fun time. I hope that you two make an effort to attend. Thank you everyone for being part of today's edition of the program. We dedicated it to cancer survivors as we are all celebrating the month of this month is spotlighting cancer survivors. And if you know one, give all the support that you can. It's life continues. You don't have to stigmatize them or anything. Thank you again for being part of the show. Until next time when we come your way, it's been a wonderful episode. Have a restful evening.